Have you ever woken up with a strange symptom and brushed it off as just part of getting older? You're not alone. But what if those early morning signs were actually your body's quiet cry for help? And the most dangerous part? These signs often appear in the quietest part of your day, the moment you wake up. According to the American Cancer Society, nearly 60% of all cancers occur in adults over age 65. Yet early signs are often dismissed or misdiagnosed, especially in seniors. Why? Because many symptoms show up in subtle, non-specific ways, and often first thing in the morning. Today, we reveal 5 signs of cancer that are often mistaken for other conditions in older adults. Important information that could save your independence and even your life. If you're over 65, this could be one of the most important videos you watch this year. Before we dive in, please subscribe to this channel. Every day I share practical, doctor-backed insights to help you stay sharp, independent, and in control of your health. Let's start with the first morning warning sign, one that many people write off as poor sleep or dehydration. Sign number 1. Persistent morning nausea or sour stomach. Waking up with a queasy feeling or an upset stomach in the morning? While it might seem like just a sign of indigestion or aging, persistent morning nausea can be a warning signal of something more serious. According to research from the American Cancer Society, persistent nausea or feeling of a sour stomach can be an early symptom of cancers affecting the digestive system, such as stomach cancer, pancreatic cancer, or liver cancer. More than 25% of patients with these cancers report nausea as one of their first symptoms, often before other obvious signs appear. Unlike the occasional stomach upset caused by a meal, cancer-related nausea doesn't go away after eating or resting. It can linger, disrupt daily activities, and worsen over time. Take Joan, 68, for example. She thought her morning nausea was just due to a mild digestive issue, but when it didn't improve for weeks, she decided to seek help. After several tests, Joan was diagnosed with pancreatic cancer, which had started affecting her digestive system. The takeaway? If morning nausea or a sour stomach becomes persistent and doesn't go away, don't brush it off. Seek medical advice and ask your doctor for further evaluation. Next, we'll look at another easily overlooked symptom that's often mistaken for a common medical condition. Sign number 2. Morning hoarseness or voice changes. Do you often wake up with a hoarse, raspy, or weak voice? At first, it may not seem like anything to worry about. You may think you're just sleeping with your mouth open or that the air in your room is too dry. However, if this hoarseness persists over time, it's important not to ignore it. While temporary hoarseness can sometimes be caused by harmless factors like allergies, dry air, or acid reflux, a chronic change in your voice, especially if it's more pronounced in the morning, could be a sign of a more serious problem. In fact, a study published in the Journal of Cancer Research and Therapy found that persistent hoarseness in older adults is one of the earliest symptoms of nasopharyngeal cancer in nearly 18% of cases. Unfortunately, many people mistake this symptom for normal aging or acid reflux, delaying proper diagnosis. If your voice has changed and hasn't gone back to normal after 3 weeks, even if you don't feel sick, ask your doctor about a head and neck exam. A simple laryngoscopy, a quick look at your vocal cords, may reveal what's really going on. Have you ever noticed that your voice sounds strange in the morning? Type voice below to share your experience. It may help someone else. Next up is a subtle change that many older adults overlook, but doctors say could be a warning sign of one of the most common cancers. You'll want to hear it. Sign number 3. Morning pain in one spot, especially in the back or side. It's easy to blame morning aches on a bad mattress, poor sleep posture, or arthritis. But persistent pain in one specific spot that shows up most clearly in the morning may be a sign of something more serious, including cancers affecting the kidneys, pancreas, spine, or nearby organs. In a 2021 review published in Aging and Disease, researchers noted that localized, persistent pain in older adults, especially in the back or flank, was one of the earliest and most underreported signs of renal, kidney, and pancreatic cancers. That's exactly what happened to Harold, 74. He had a mild ache in his right side every morning for nearly a month. His doctor thought it was muscular, maybe from yard work. But when the pain got sharper and started waking him up before sunrise, Harold insisted on further tests. If you have morning pain in the same spot for more than 2 weeks, especially in the lower back or side, talk to your doctor. Ask about imaging tests like an ultrasound, Connecticut scan, or MRI, depending on the location of your pain. If you found this information helpful, be sure to like and share this video with a friend or loved one, especially someone who is experiencing a similar situation. This video could save their life in the future. Next, let's look at an easily overlooked morning symptom, but one that could signal a cancer related to the blood or immune system. If you've ever woken up in a sweat or with a cold for no apparent reason, you'll want to hear this. Sign number 4. Unexplained morning sweats or chills. Have you ever woken up drenched in sweat or shivering under the covers, even when the room wasn't cold? Occasional night sweats can come from menopause, infections, or even certain medications. But when sudden sweating or chills happen regularly in the early morning hours without any clear cause, it might be a red flag, especially in older adults. These symptoms can point to blood-related cancers like lymphoma or leukemia, or immune system cancers that trigger internal inflammation and hormone-like chemical release during sleep. A study published in the American Journal of Medicine found that persistent, unexplained night sweats were reported in up to 30% of early lymphoma patients, especially in adults over 60, and often appeared months before other symptoms, like weight loss or swollen lymph nodes. That's what happened to Lorraine, 69. She began waking up soaked in sweat a few nights a week, then started noticing chills and body aches around 4 or 5 a.m. Her primary doctor at first suspected a mild infection or thyroid problem. But when basic tests came back normal and the symptoms persisted, she was referred to a hematologist. Further testing revealed early-stage lymphoma. Try placing a dry washcloth or small towel under your neck or shoulders when you sleep tonight. In the morning, check it. If it's damp, and this happens more than once over the next few nights, jot it down. This simple check can give you proof of sweating episodes you might otherwise forget by the time you see your doctor. Waking up in a sweat or shaking with chills, do you really think that's normal? Leave a comment if you've ever experienced this, because staying silent could be costing you more than you think. Your health could be at risk. Still feel exhausted after a full night's sleep? In this last sign, we'll reveal why that kind of deep morning fatigue could be an early warning sign your body is fighting cancer. Sign number 5. Feeling wiped out, even after a full night's sleep. Do you find yourself waking up every morning still feeling exhausted, even after sleeping through the night? It's easy to brush this off as a result of aging or staying up too late. But if you're constantly feeling wiped out no matter how many hours you sleep, it might be time to pay closer attention. This was the case for Lily, 72. She thought it was just a normal part of growing older, feeling tired every morning. But when her exhaustion got worse and she started feeling unusually short of breath, Lily knew something wasn't right. After a blood test and further screenings, she was diagnosed with chronic leukemia, which had been silently draining her energy. Key signs to watch for: waking up still feeling tired despite a full night of rest, unexplained exhaustion that lasts throughout the day, difficulty breathing or trouble concentrating, unexplained weight loss, or pale complexion. Fatigue is one of the most common, yet easily overlooked, early signs of blood cancers, like leukemia and lymphoma. Research published in the Journal of Clinical Oncology shows that up to 70% of lymphoma patients reported feeling extremely tired long before they were diagnosed. If you wake up feeling drained, no matter how long you sleep, don't let it slide. Talk to your doctor about getting blood work done, particularly to check your red and white blood cell counts. Early testing can help catch issues before they become serious. And if you've ever felt unusually tired in the morning, no matter how much sleep you get, leave the word tired in the comments. Your story could help others take notice even more. Let's quickly review the 5 overlooked morning symptoms that could be early cancer signs in seniors. Persistent morning nausea, or sour stomach. Voice changes or hoarseness. Localized morning pain. Unexplained sweats or chills. Fatigue that sleep doesn't fix. Remember, catching cancer early dramatically improves outcomes. According to the National Cancer Institute, early detection can increase 5-year survival rates by over 80% for many cancers. So, if you or someone you love is experiencing 2 or more of these symptoms, don't ignore them. Talk to your doctor and request a full evaluation, even if the symptoms seem minor. If you found this information helpful, please hit the like button and subscribe for more Dr. Back videos focused on senior health. Also, check out my other videos for related videos that can help you proactively prevent serious health problems.